Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few practice questions from the E&M section, Evaluation and Management session. Let's look one by one. Now let's discuss each and every questions one by one. The first question, a 20-day-old infant was seen in the emergency room by the neonatologist admitting the baby to an ICU for cyanosis and rapid breathing. The neonatologist performed intubation, ventilation management, and a complete echocardiogram in the ICU and provided a report for the echocardiography which indicates congenital heart disease. Select the correct codes for the physician service. So these are the options mentioned. Let's look into one by one in the CPT code book. I'll show you the codes as well in the book. First, let's look into all the E&M codes from all the options. Okay, so the first option is 99468. See, this is 99468, which represents initial inpatient neonatal critical care per day for the E&M of a critically ill neonate 28 days of age or younger. Here the age is 20. So this can be the answer. Anyway, let's move on to option B. E&M. We'll just look all the E&M codes first, okay, from all the options. So option B, 99471. That's also here. Initial inpatient pediatric care, but here the number of days is 29 days through 24 months. That will not be the answer. So what will we will do? So B will not be the answer. Now option C, 99460. What is 99460? Let's take 99460. 99460 is here. Initial hospital or birthing center. This is not a birthing center, right? This is in the emergency room. Okay, so initial hospital or birthing center care per day for E&M of normal newborn infant. Anyway, this is not a hospital or birthing center. This is this is in the ER emergency room. So this will not be the answer also. Now, next option, last option, 99291. Let's take 99291. Yes, it's here. Critical care evaluation and management of critically ill or critically injured patient. First 30 to 74 minutes. That also will not be the answer, right? Because this is for a critically injured patient or critically ill patient. Here, the baby was seen by neonatologist and admitting the baby to NICU for rapid breathing. So this is a direct emergency room, direct emergency department. So this will not be the answer, and also this is not the first. See, the time mentioned is first 30 to 74 minutes, and the age is also not mentioned. So according to the 4 options, let's go with the first option and let's see the remaining codes. 99468 we had already taken. Now 93303. What is 93303? And before that, 99468 is appended with modifier 25. What is modifier 25? Modifier 25 means if the physician has done some extra procedures apart from the initial procedure. So here the doctor has done what all procedures? Initially performed intubation, ventilation management, and complete echocardiogram. And provided a report for echocardiography. Yeah, so apart from admitting the baby to an ICU, the physician performs all these procedures: intubation, ventilation management, echocardiogram, everything has been done. That's why 25 modifier is then multiple procedure. Now 93303. What is 93303? that represents ECG. It's a code for ECG, okay? And modifier 26, what is modifier 26? Modifier 26 represents if the physician has done like a written report, anything which is in written report without performing the test. That is called a modifier 26. So here the doctor has done echocardiogram only and then provided a report for the echocardiography. Report for echocardiography has been provided, which concludes congenital heart disease. So only with the echocardiography the doctor has concluded it as congenital heart disease, provided a written report for that. No other major procedures has been done. So in that cases we will append modifier 26. Okay. So this will be the answer. The answer will be option A 99468 with modifier 25 and 93303 with modifier 26. Second question, a 50-year-old patient is coming to see her PCP, means primary care physician, for hypertension. Her physician performs an expanded problem-focused exam and low medical decision making. After the exam, the patient discusses with her physician that the OB-GYN office had just told her that her pap smear came back with an abnormal reading and is worried since her aunt had passed away with cervical cancer. The physician spends an extra 45 minutes face-to-face time discussing with her the awareness, other screening procedures and treatment if it turns out to be cervical cancer. What codes should be used for this visit? So let's look into one by one options in the CPT code book. Now in this question, let's look into the first option 99215. What is 99215? 99215 is here. What is 99215? Office or other outpatient visit, comprehensive history, comprehensive examination, medical decision making of high complexity. In our question, it's mentioned. What is mentioned in our question? Problem focus, expanded problem focused examination, low medical decision making. Expanded examination. No, this is comprehensive. So this will not be the answer. Now what is 99213? 99213 represents an expanded problem focused history, expanded examination and low complexity medical decision making. So here problem focused is expanded, low medical decision making. Yeah, both are written there. This can be the answer. Still, let's look into the other options. 99212. What is 99212? See here. 99212 represents problem focused history, problem focused examination, straightforward decision making. This also will not be the answer, right? Because our option is in our question it's mentioned low medical decision making and expanded. So the answer will be 99213 only. This one 99213. But check option D. 99213 along with 99403. What is 99403? See 99403 is here. That is preventive medicine counseling. Approximately 45 minutes. There is nothing mentioned in the question about preventive medicine, right? So the answer will be option B, 99213. Now third question. Documentation of a new patient in a doctor's office setting supports the history in 4 elements for an extended history of present illness. This extended history, review of systems, all these you can expect it as a short form also, like HPI, history of present illness. 3 elements for an extended review of systems, ROS. And 3 elements for a complete past family social history, PFSH. Past family, social history. You may not be getting all these expanded terms in a few examination. So make sure you understand these abbreviations also, okay? There is an extended examination of 6 body areas and organ systems. The medical decision making is of high complexity. Which A&M service supports this documentation? Let's look into one by one options in the CPT code book. First option 99205. What is 99205? Office or other outpatient visit, comprehensive history, comprehensive examination, and high complexity MDM. What is in our question? Medical decision is high, yes. Extended examination. Extended examination of body parts. So this is comprehensive. So this will not be the answer. What is 99204? 204 is also here. Comprehensive history, comprehensive examination, and moderate complexity. No. Next one 203. What is 203? Is detailed history, detailed examination, and low complexity MDM. In our question, detailed examination is there extended or detailed? Extended means detailed, right? The other one is expanded. Don't be confused with the words. Extended history of illness means detailed history. Extended examination means detailed examination, and our medical complexity is high. But 2 components is enough. Still, let's look into the other option, last option 99202. 99202 is here. Expanded problem focused, expanded examination, straightforward decision making. This also will not be the answer. Ours is not expanded, it is detailed. So the answer will be option C, 99203. Fourth question. A physician makes a home care visit on a 63-year-old patient, that is a hemiplegic, having insomnia for the last 2 weeks. The patient has been homebound for the last year. The last visit from this physician was 4 months ago to control his diabetes, diabetes mellitus. The physician performs an expanded problem-focused examination and low medical decision making. The physician then speaks with the spouse about the possibility of placing the patient in a nursing facility. What CPT code is reported? So these are the options, and let's look into one by one. First option in this question 99213. Here it is. This is office visit. But this is office visit code, right? What is in our question? Our question is home care visit. So 99213, this is office or other outpatient visit. So this will not be the answer. Let's move to option B, 99342. See, 99342, home visit. Under home visit, expanded problem focused, expanded problem focus history and examination, and low MDM. In our question, expanded problem focused exam and low MDM. It's there. Okay, let's move to other option. Option C, 99348. This can be the answer, but option B can be the answer. But let's look into the other 2 options also. Okay, 99348. So here in this is 99348. Home visit, expanded problem focused interval history, expanded problem focused examination, and medical decision making of low complexity. Here also it looks same. It looks similar like option B. What is 99350? Option D. That's also here. But it is comprehensive interval history, comprehensive examination, medical decision making of high complexity. No. So this is not comprehensive. So compare to option B and C. And one more thing, in option B 99342, that is a new patient. 99342 is a new patient visit, and 99348 is an established patient. Okay, so this is an established patient. See, 99348 comes under established patient. This patient is already seen by this the same doctor 4 months ago. So this is an established patient. So answer will be option C, 99348. Okay. One more question. A 28-day-old male child is brought in the emergency room in respiratory arrest with suspected SIDS. The emergency room physician performs critical care for 45 minutes. In addition to the critical care time, CPR, placement of a central venous line, and emergency endotracheal intubation are performed. What procedure codes are reported for this encounter? So these are the options. Let's check one by one in the CPT code book. Here the first option 99291, which represents critical care patient. This is a critical care question, right? Patient, right? Emergency room physician performs a critical care for 45 minutes. So what is 99291 code? 30 to 74 minutes. So it can come in this code because the number of the duration of the time is 45 minutes. So it will be here. This is 30 to 74 minutes. Okay. Still, let's look into option B. Any other E&M code for option B? Yes, 92950. No, that is not E&M code. 92950. E&M code option C, 99466. What is 99466? This is critical care face-to-face services during an interfacility transport of critically ill or critically injured pediatric patient 24 months of age or younger, first 30 to 74 minutes. Hands-on care during transport. There is nothing mentioned about transport or emergency transport or nothing like that. So this will not be the answer. Okay. Option D, 99284. Let's take option D. 99284. This is just a hospital visit. The code. See, emergency department only. See, hospital visit, but emergency department. 99284 represents the emergency department. Detailed history examination and moderate MDM. No, this is nothing mentioned about critical care. So this will not be the answer. So the answer will be option A, 99291, which represents critical care services for 32 is 1. Up to 74 minutes, 30 to 74 minutes. In our question, it's mentioned 45 minutes. With modifier 25, because the doctor has performed additional procedures, right? In addition to critical care time, CPR and placement of central venous line and emergency endotracheal intubation are performed. So what are the three things performed? 36555 is, so which are the additional codes apart from critical care apart from this critical care code? 36555 represents the insertion of central venous device. Okay. And what is 92950? 92950 represents this one, CPR. CPR is also performed, right? So 92950 represents the CPR. Now one more code is there, 31500. 31500 represents endotracheal intubation. So all these three additional procedures are also performed by the doctor. So the answer will be option A. So friends, these are few questions from the previous year's examination papers, CPC examination papers from E&M session. So if there is any comments or queries, you can mark it in the comments. If you are new to the channel, please subscribe to my channel and please support my videos. Thank you so much. Take care. Bye.